Good afternoon, everyone. Welcome to the Michigan Works Association 2021 Annual Conference. My name is Jeff Cassidy. I am the Director of Policy with the Michigan Works Association. On behalf of the staff at the association and all of our sponsors, we thank you for being a part of the conference and this session titled Thrive versus Survive, Stress Management During COVID-19. A big shout of thanks to CVS Health for sponsoring today's workshop session. Our sponsors help make this conference happen, and we're very thankful for their support. Along with our sponsors, our exhibitors who have also given their time to be a part of our event. Be sure to visit the exhibitor booths during the designated exhibit hall times. Before we begin today's session, there's a few housekeeping items I'd like to share with you. Please make sure that your audio is muted. And if you have any questions or comments, please put them in the chat and I'll collect all the questions and we will have a Q&A at the end of the presentation. We're also eager for your feedback about the conference and this session, so please take a few moments to complete a short survey. I'm going to put the link to the survey in the chat, so please do complete that survey at your leisure. And now I'd like to introduce the speakers for this session. Linda Watson is a site manager for the Michigan Department of Labor and Economic Opportunity. Nasha Ely is the business relations consultant with the Michigan Department of Labor and Economic Opportunity. And Aaron Wallace is lead outreach specialist with the Michigan Department of Health and Human Services. Nasha?
Well, we're already experiencing our first technology issue because Nasha, your audio isn't working.
I think you're muted, Nasha. Just go ahead and unmute.
So Nasha will be right back with us. Just real quick to introduce ourselves. Once again, my name is Linda Watson. I'm a site manager with Michigan Rehabilitation Services. Aaron, go ahead and introduce yourself while Nasha gets up.
Hello, everyone. I'm Erin Wallace. I am the lead outreach specialist with the Stable Grant Program that is managed by the Michigan Department of Health and Human Services.
And I'm Nasha Ely from Michigan Rehabilitation Services Business Network Division. So thank you for having us today, and we will proceed with our training. Today's learning objectives, There we go. With today's learning objectives, we hope you understand the impact of COVID-19 and overall mental health while discussing the impact of reintegration into the workplace, stress and trauma on mental health during COVID-19, that you'll learn the benefits of self-awareness and overall self-care, provide information to promote mindfulness and good mental health while working in unprecedented times, and you'll obtain strategies on next steps when a customer or a coworker demonstrates signs or behaviors of struggling on the job, including strategies to help managers address the fears.
So let's give some background information. We've all seen many different challenges in the workforce recently as it relates to the impact of COVID-19. Businesses still need talent, and we still need to assist them with those needs. So during the pandemic, here are some things that we have heard businesses saying. And you can go ahead and just tab over, Nasha, and bring those things up. So a reduction in 10,000 applicants, one business reported from 2019 to 2020, that's nationwide. That was within the banking industry. Applications overall are down 1,000 per month in the last quarter, and that was from a healthcare business. 238,000 were unemployed as of before July, and 450,000 claims were filed per week in July. But still, job leads were going unfilled, weren't they? These are things that I know and things you know as well. So I bet that sounds familiar to you. And I'm guessing that you've probably had to deal with this a lot yourself in the work that you do. Regardless of industry, regardless of business size, of level, business revenue, it doesn't really matter. Every business is feeling this now. And really, this sort of talent crunch doesn't even account for things like attrition, medical leaves, or other untimely employee exits that we definitely see. Maybe you've attributed this to one single thing in COVID: fear, unemployment, stimulus disincentives, the need for psychological safety. But really, the fact is that one single reason isn't to blame. There are many aspects of this concern that have nothing to do with any of those things that we mentioned. Next slide. So on the previous slide, I did just share that business reported being down 10,000 applicants per month, between 2019 and 2020. That business also shared with me that their chief demographic for new applicants had been working moms, so people just like me. Moms of school-age children who wanted a position to work during the same hours that their children were in school. And that had really been a high number of applicants for that particular business. It really worked out perfect in the banking industry. But take a look at this chart. Mothers are much more likely than fathers to have experienced a disruption to their work life due to the COVID-19 pandemic. And ultimately, mothers are much more likely than fathers to leave work. So let's dig a little bit deeper into this. For this one particular demographic, they're experiencing all the stressors of every other population impacted by COVID, but also what many refer to as mom guilt. I personally have experienced that, and now in COVID-sized buckets. So how are mothers going to feel about going back to work? Well, even before the pandemic, they had trouble re-entering the workforce after leaving to take care of their children. 1 year leads to 5 years, and eventually times have changed. The work requires new skills, networks decayed over time, and everything is just so different. Finding a job becomes very difficult with particular needs, such as having more flexible schedules and work that really fits in with your family life overall. Mothers may encounter the same challenges after COVID-19, and we expect that they will. Some mothers have even stated that they might not return back to work even after the pandemic has cleared because they felt like they've been missing out on their children's lives for so long, and this gave them that glimpse. With all this sense of responsibility, emotions can become overpowering. And on top of this, another particular demographic of working mom, Black women, are least likely to feel supported at work. So your workforce is actually facing multiple stressors, facing less support than ever before at work, and facing more pressure to leave work altogether. Erin?
Thanks, Linda. So aside from the unique impact of women in the workforce, many other populations are experiencing factors that can impact mental health and have really worsened with the pandemic. Mental health is one area of impact, as noted here on this slide from the CDC, and we're seeing an increase in fear of sharing concerns. Really, what's staggering is that a third, or 30% of employees are reporting being fearful that disclosure of mental health with that fear of COVID to really leading to being fired or being furloughed, and that's a large percentage of our workforce. Next slide.
In fact, this is what the workforce was saying even before COVID. We know that work can impact mental health. 3/4 of employees believe the worker has more on-the-job stress than a generation ago. And I'm sure we can all agree with that statement along with the other two on the screen. Take a look at this bar graph. This represents all level of workers today, from your C-suite executives to mid-level management and frontline employees. Approximately 50% across the board are reporting that the stress from their job always or often affects their personal relationships. And overall, 80% of employees indicate that workplace stress, sometimes impacts their life outside of work. Since we are all working to enjoy what comes after our metaphorical 8 to 5, we need to take active steps to ensure that this number decreases.
So let's again go back to looking at COVID's impact on talking about workplace stress. So the Household Pulse Survey, or HPS, is a report describing trends in the prevalence of symptoms of an anxiety disorder or a depressive disorder among adults. This shows that between early in August, so between 8/4 and 8/16, 30.9% of Michiganders reported feelings of anxiety and or depression, 1/3 of our state. While these reports have shown that percentages have fluctuated some, what it really tells us is that as a state, roughly 1/3 of us have been experiencing anxiety and symptoms of depression for almost a year and a half. Nationally, that same report showed 41% of Americans experiencing anxiety and depression. Mental distress during the pandemic is occurring against the backdrop of high rates of mental illness and substance use that existed prior to the current crisis. Next slide, please.
So before we go any further, I want to take a moment and pause with you guys. I want you to look at the screen right now. What exactly do you see? You can toss that in the chat. You can keep it to yourself and just kind of answer that question. So we know that some people, when they look at this, let me see, a man playing an instrument. Great job, Eric. Yep, lady's face, a woman's face. Absolutely. So we do know that some people have seen a man playing an instrument, perhaps a saxophone. We've also heard from people saying that they can see a lady's face. But now that I have told you that there are two different things, can you see both of them? We want you to really think hard about that because we know that it's possible to change perceptions over time. What we've been discussing is really poor mental health, right? And I know from the question I put in chat that a lot of you can actually relate to that, specific to what's going on in COVID. So what does poor mental health really look like, though? And what is your picture of poor mental health? Much like this picture in our perception of what we see here, we may all perceive poor mental health a little bit differently. But poor mental health is actually a mental illness. And for more on that, I'm going to turn it back to Nasha.
Thank you, Linda. Mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Many disorders have been described with signs and symptoms that vary widely between specific disorders. Conditions may be occasional or chronic and affect an individual's ability to relate to others and function each day.
I love this image, and really it's kind of like a self-portrait is what I feel. So how does this all apply to you and me? Really, this self-portrait, if you will, it represents the overwhelming life that we've lived for the past year and a half. Staff, a variety of workforces, are trained to be flexible and to deal with needs as they arise, whatever those may be. But COVID-19 is a completely different ballgame. During this pandemic, you have faced and your customer base are facing traumatic experiences in both your professional and your personal worlds. You face challenges at work, perhaps the fear of contracting the virus, anxiety about continued remote work, or having to be in person, and more, including the roll-on effects of the pandemic. Meanwhile, you have to contest with coronavirus-related challenges in your own life. So that may be children that are home from school, partners that are out of work, extreme fatigue, or other pressures. With any staff, we train and are trained to keep our professional lives and our personal lives separate. Leave it at the door, if you will. But the boundaries between these two spheres are completely blurred, and you're sharing that same collective trauma as the communities that you serve, and we have to continue to acknowledge this. Next slide, please, Nasha. Thank you. So throughout all of these blurred lines, I'm curious, how many of you are having a hard time focusing or have had a hard time focusing? You can throw that in the chat if you've experienced it. It really seems like ages now since we've started referring to life in these uncertain times. Our routines have been disrupted and we've been forced to adapt. really anecdotally, one major consequence is a state of mental fatigue. It can feel hard to concentrate for any length of time, as if we're in this collective state of near constant distraction. And I'm seeing in the chat that many of you are experiencing this as well. I can tell you from a personal standpoint, I started researching this to see, is there some additional effects as to why I'm having a hard time focusing and concentrating as well? And what I found is that, yes, there is. It's a psychological theory that can help to explain why living in the age of COVID-19 has made it really hard to concentrate. And it's called the cognitive load theory. And it was first developed by the Australian educational psychologist, John Sweller. So put really simply, cognitive load theory characterizes our minds as information processing systems. So when we're working on a problem, especially one that's unfamiliar, we depend on our working memory, which we know can be limited both in its capacity as well as the duration that it can hold on to new information. So first and foremost, really by forcing us into new routines, it's robbed you of the ability to do things on auto. These adaptions really force you out of autopilot and draw on your limited working memory capacity. Second, emotions can interfere with information processing. So if you're anxious, for example, this is known to reduce working memory capacity, making it more difficult to work through really any type of challenge. So what's happening now is that disruptions to life caused by the pandemic are forcing you to draw on your limited working memory capacity more often at a time when, if you're more stressed or you're more anxious, those anxiety levels are raised, you have a diminished working memory capacity. And it's really the worst of both worlds. And it's another reason why you may be feeling mentally drained. Ordinarily, in a time of upheaval, we can really just adjust quickly and that cognitive load becomes more manageable again. But what's striking about life in the era of COVID-19 is that our situation keeps changing. And really, there is barely a day that goes by without a new development for us to register and respond to. So again, in general, uncertainty will always increase your cognitive load. I'll turn that over to you, Linda, then.
Yeah, thanks, Erin. And collectively, we've been experiencing COVID for well over a year now in our country and around the world. Perhaps the only thing we can agree on is that our experiences in this era are totally different than anything we've experienced before in our lifetimes. As Erin just described, we're faced with all different types of stressors and unknowns. Everyone has experienced a loss, and it's important to acknowledge that. And not only one loss, probably multiple losses. The loss of control of our routine, our expectations, the hope of what's coming tomorrow. I personally was robbed of a graduation ceremony for my oldest child a couple years ago. But people have lost weddings. They've lost the opportunity to grieve at funerals. Definitely a loss of social interaction. The world that we have now looks vastly different than the one we had 2 years ago. Some people have lost income and lost jobs, where others have lost work-life balance. They find themselves working too much, more hours to cover for the other people that are unable to work right now. And ultimately and unfortunately, some people have experienced loss of health and loss of loved ones. Now more than ever, it is super important for us to be mindful of our own mental health and take intentional steps to promote good mental health. So we hope to help you do that here. Next slide.
Absolutely, Linda. So the items that are listed here on this slide may actually seem like kind of Captain Obvious statements, but I think that they're really validating and acknowledging them simply. So knowing the common work-related factors that can add to stress during a pandemic. So concern about the risk of being exposed to the virus at work or bringing the virus to work. Taking care of personal and family needs while working. That juggling act is not easy. There's managing a different workload. So wearing more hats than what we wore previously. Lack of access to the tools and equipment needed to perform your job. We've all actually, even just today, have experienced issues with internet and connection, and that definitely raises the stress factor for you. There may be feelings that you're not contributing enough if you're not working on the front line, uncertainty about the future of your workplace and or employment, as well as irregular or longer hours. And I'm curious, how many of you can identify with any of these 7 points or all of these 7 points? Feel free to throw that in the chat as we continue to move to the next slide. So in many different fields, employees can suffer burnout, and this is really nothing new. Burnout is a state of complete and utter exhaustion due to the work that's been undertaken, and you've probably experienced this before. As you've really just kind of worked very excessively to the point where you're not functioning properly at all. Burnout right now is so common, and it can affect us both mentally and physically. So while we won't dive super deep into everything that contributes, I do just want to talk and hit on just a few components that really add to burnout or can cause burnout. So stress. We just talked about the 7 items, the most common factors that can add to stress during a pandemic. Feelings of lack of support because everyone's in a divide and conquer mode right now. There may be feelings of lack of job fulfillment. The work that you used to do was bringing you great satisfaction, and you're experiencing difficulty with that now. There may be feelings of not able to do enough for people, as well as emotional exhaustion. Next slide, please. So this quote really articulates burnout in such a visual way. The work that you do can be taxing. You want the best for your clients and your team, as that means the best for our economy. But across the state, across the board, staff are suffering right now, and that's really hard to watch. You're providing resources for your organization, and you really can become invested in helping people succeed. That workplace can take on the feeling of a second family. This work can be really rewarding, but it can also be emotionally draining. So as you've worked throughout this pandemic, you may have noticed that you or someone you know has experienced feelings of hopelessness or a belief that change is impossible. Social withdrawal from coworkers, friends, family, or even society at large. Perhaps a sudden episode of unwarranted or disproportionate anger. And these really are some of the signs of secondary traumatic stress, which can lead to compassion fatigue. Next slide, please, Nasha. The term compassion fatigue was coined to describe the phenomenon of stress resulting from exposure to a traumatized individual rather than exposure to the trauma itself. We've heard and possibly lived through devastating stories related to this disaster. Compassion fatigue is often an extreme state of tension and preoccupation with the emotional pain and suffering and or physical distress of those being helped can really create that secondary traumatic stress for the individual. When that's then converged with cumulative burnout, that state of physical and mental exhaustion caused by a depleted ability to cope with one's everyday environment, compassion fatigue results. Next slide, please, Nasha. Thank you. So I want to mention this woman. Her name is Taryn Hughes, and she's a compassion fatigue therapist and a compassion fatigue educator. And she's coined the term COVID traumatic stress. It's a theory within the framework of secondary traumatic stress. So we've talked a little bit about this already and both of its professional and interpersonal effects. But really, while many have experienced direct loss or illness to COVID-19, there are millions of others that are living in a constantly triggered state due to the rapid changes in society, such as loss of human interaction, the enforcement of state regulations that dictate when and how people can go out in public. In addition to the ongoing risk of exposure to the virus, really all leading to increased anxiety and fear. And essentially, people are locked into this fight or flight, really kind of bracing for that next danger. Reentry really seems to be the next big hurdle, leaving many people paralyzed with fear and anxiety. And it's important that we acknowledge that people's brains and bodies are struggling to adjust to that constant change and really making sense of a new daily reality, which in many instances contains nothing familiar. This continues to be that unprecedented situation for virtually everyone on the planet. Next slide, please, Nasha. Thank you. So I want to share with you some of the symptoms of COVID traumatic stress. And I mentioned in the chat earlier that there is a resource packet that we've compiled, and it has lists of signs, symptoms, and triggers for burnout, as well as compassion fatigue. And we'll have all of the information that we're sharing with you and the resources for that as well, in case you're wanting to do any additional reading. But I wanted to bring up the symptoms of COVID traumatic stress, specifically for the items that are highlighted in bold here, because these symptoms will show up differently for everyone. But specifically with COVID traumatic stress, we're seeing so much of this, and it's so prevalent in our society right now. Go ahead, next slide, please, Nasha. So with those symptoms that you are seeing and that you may be experiencing as well, it's important to note that symptoms are a response. They're not a weakness. In a time like this, we know that people are struggling, and it's imperative that we help one another cope. Remembering that symptoms are temporary and are happening in response to a global pandemic. Symptoms don't mean that something is wrong with the person. It's really the body's natural response to prolonged stress and anxiety. So let's think of this in a really different way. So the symptoms that we see are like a flashing battery light that's signaling that it needs to be plugged into a grounded outlet to replenish its energy. That grounded outlet can be a trusted friend, a therapist, a coach, a health practitioner, or it may be the Stay Well program that's available to support you. It's so important to have compassion for our traumatic stress response. Being gentle and understanding that our bodies and our brains are really can help us to cultivate that self-compassion and tenderness towards others. And during that scanning for danger process that occurs in our brains, mistakes or generalizations are often made. We can mistakenly categorize a benign circumstance, group of people, or behaviors as dangerous when really in actuality they're not. Understanding that trauma isolates and blocks connections to others can really help us to take that brave step toward helping another person. That single action of interpersonal connection can help to release fear while simultaneously calming our nervous system. Next slide, please, Nasha. So with all of that, and we hear what those effects are on us as individuals, it's important to note that it's not just individuals who are being impacted by COVID traumatic stress. Small, medium, and large businesses, as well as nonprofits and government agencies, are being impacted all at the same rate. So when a large group of staff are impacted by compassion fatigue or COVID traumatic stress, communications can break down. You may see inter-office tensions increase and the distrust in leadership may arise. Additionally, COVID traumatic stress can slow down day-to-day operations because of employee error, decreased productivity, challenges to organizing and prioritizing, as well as health-related symptoms. So executives, managers, and supervisors are also living through many of the symptoms, simultaneously being held to a higher standard of actions by themselves as well as others. So again, breaking that silence will help everyone to realize that they're not alone in this experience, that there's great comfort in sharing, and connecting with calm, supportive people can really help to soothe your nervous system. Next slide, please, Nasha. Thank you. So your pain, your discomfort, and your worries, they're valid too. And it's important that you continue to process and grow through your own life challenges, as often there's a tendency to ignore your own problems because they don't feel as severe as those that you serve. Really, that hierarchy of pain can be a master trickster, because that same voice that condemns your own pain as not worthy of attention is the same voice that condemns the pain of people who are suffering, maybe just a little bit. Those you deem to have more privilege and smaller problems, it can judge them for being too sensitive or overreacting to their life challenges. When we activate self-compassion, we can in turn let go of that voice of judgment towards others and really begin to meet them where they are. Next slide, please. So there's a free resource called the ProQual, or the Professional Quality of Life Measurement Tool, which is a very effective tool in measuring both where your team is at as well as where you are at in terms of burnout, compassion, fatigue. On their website, you can access their self-administered test, how to score properly, as well as additional resources to share based on the results that you're seeing. You don't have to be certified to share this test. It's really, really easy to take, and it can also be translated into 28 different languages. With that, I'll turn it over to you, Linda.
Thanks. So part of the reason why we're talking to you about this today is because left unchecked, we move into a more severe category, and it's really important to know the impact of mental illness overall. It truly does have a negative ripple effect in America. Individuals who are diagnosed with mental illness are at an increased risk for co-occurring conditions, either other mental illnesses such as anxiety with depression, or they develop a substance abuse disorder, perhaps as a way to self-medicate. In fact, 19% of those with mental illnesses have a diagnosed substance use disorder. However, it's not just additional mental illness concerns. Those with these diagnoses also have an increased risk of chronic disease, such as diabetes or cancer, which is twice as high in adults with serious mental illness. You can see from the screen, there's a large percentage of individuals who are incarcerated that have mental illnesses. Once again, there's power in numbers. And even with the gross stigma that is truly associated with mental illnesses, these reported numbers are very high. So it's so important to take steps to improve your mental health through awareness and treatment interventions and protecting the good mental health that you have. So now we're going to turn towards giving you some solutions and some resources for that. Erin?
Thanks, Linda. So looking at how to thrive in our work merely than just surviving. So the tactics employed will vary for each person, but here are 8 rules that really have helped to navigate the challenges that can cause burnout. So first is setting boundaries. It's important to work reasonable hours and commit to disengaging from work based on the commitment that you make with yourself. This will be different for everyone, but this rule is crucial. It's important to acknowledge your limitations. You have to embrace the fact that you can't help everyone all at the same time, accepting that there's only so much that you can do and that this is enough. And that acceptance will really allow you to be present both at work and outside of work as well. Creating a space for yourself. So take time to relax, recharge, unplug as often as possible. Learn to ask yourself the question, what is it that I need right now? At one time, it might be solitude. At another time, it might be social support. The next is being active. And really, I like to think of this as more of a core 4. So eating foods that will help to fuel your body, providing adequate time for sleep, staying hydrated, and staying physically active. And really, when you look at this, these are foundational factors for thriving, regardless of your profession and regardless of being in a pandemic or not in a pandemic. Want to encourage you to find non-work outlets. So another critical aspect of sustaining and thriving is creating a life outside of work, So that means engagement with hobbies, friends, loved ones, creative endeavors, and whatever your interpretation of spirituality may be. Encouraging you to utilize your network. So turn to your coworkers. They understand what the days look like in this workforce. Want to also encourage you to implement a mindfulness practice. And Linda will talk about this here in just a moment. And then lastly, consider speaking with someone. So to the extent that you increase self-understanding and development, you build resilience and you're able to relieve stress. And really with that, I'll turn it right back over to you, Linda.
Thanks so much. Okay, so these are tips that are practical and you can do this every single day to improve your own mental health. Mindful moments. Self-care isn't something that you do in your spare time or on vacation. It's a disposition, an attitude, an ongoing state of body and mind. We encourage you to take time each day to shift from a mode of doing and action to one of pausing and being with whatever is happening right now in this moment. So as you sit, stand, or move, we want you to notice your feelings, your thoughts, and your body sensations as they come and go. And rather than signifying a time to tune out or veg out, maybe in front of the TV, Netflix, use those moments to tune in more closely to your experiences so that way you can respond to your life with more clarity and wisdom. So awareness of breathing. Right now, what I would like for you to do is I'd like for you to place your hand on your belly and notice how it rises and falls as you breathe. For 10 seconds of silence, I'm going to give you, I'd like you to focus on your breathing. Again, I want you to notice how you inhale and exhale. Ready? Go. Okay. Put aside time each day to breathe in that way. It allows you to recognize breathing when you're stressed versus when you're not, because hopefully right now you're not, because you're not presenting, as well as how to get yourself back to a state of being that is not stressed. So when you find your mind wandering throughout the day, which it definitely does, it does for everyone, just bring it back gently to focus on your breathing. This is useful to do when you feel anxiety creeping in as well. And by practicing this, the breath becomes an anchor that can help you maintain your focus and your anxiety. Body awareness. Become familiar with the parts of your body that are usually tense when you're stressed. Give them a frequent tension check and soften them when possible. It's also important to note that if you're experiencing pain across your shoulder blades at the end of your workday, that really could be attributed to stress because that's where we carry the weight of stress physically on our body. It could also be your posture though, so make sure your chair and your desk setup are in a healthy ergonomic manner and that you're sitting appropriate throughout the day. Awareness of thought. So take a moment to see where your thoughts are right now. Are they focused on what you're doing right now, or are they somewhere else? Are they back at work, trying to finish a report? Are you thinking about grocery shopping or cooking later? Notice them and bring them back to what you're doing in the present, whether it's right here or you're doing this exercise later. This exercise in mindfulness can help you concentrate more effectively the more often you do it. Single focus tasking. So multitasking may have become the norm today. It's probably better suited for computers because human beings are not actually capable of multitasking. So what we end up doing is rapidly switching tasks, going from one to the other, forgetting things, and not giving our best to all the tasks that we're trying to accomplish at once. We're better served by being organized, and when asked to multitask, we can make a list marking where we're at so we'll know what to come back to. Then divert our attention into the other tasks that we're given. Now, when we're able, we'll come back to that first task and give it our full attention to complete it. But multitasking is not actually real. Social support. The relationships that we have with family, friends, and colleagues are a vital source of nurturance and comfort. On a practical level, they provide concrete assistance, valuable information, and companionship. On an emotional level, they foster a sense of belonging. Now more than ever, it's important to nurture these, but also we have to be creative in how we're managing and maintaining those connections and relationships. Altruism, finding small ways to give to others. In case you're not aware of this, the act of giving to someone else actually benefits the giver. So you could do things like shopping for a friend or a loved one, do some fall cleanup in a neighbor's yard, set up a meal train for someone who's sick, or you could simply just ask someone what they're in need of and follow through on that. Attention to small wonders in life. Every day will be enhanced if you take a moment to slow down, stop, pay attention to something of wonder around you. That could be the way the sun hits the trees, even the way the rain and the lightning is happening outside, maybe a cool breeze coming through the window. Think of this as looking at the world through a child's eyes. See things for their beauty as a small wonder. Mindfulness at work. Though all of these do require that you're intentional about doing them, this one is especially so. We all get caught up in working from time to time, but it's important that we need to take our breaks. Even if you're working remotely, you still have to take breaks. If you're someone who works through your breaks or your lunch, stop it. When the workday is ended, turn off your computer and begin your after work life. And while you're at work, make those healthy choices that Erin talked about earlier for your lunch. Research shows that when you make a healthy food choice, you notice positive feelings that will reinforce the behavior of making healthy food choices, which continues the cycle of helping you feel good. Professionally, if you ever find yourself in self-depreciation mode, those I can't do this moments, stop yourself. Remember that most people suffer from what we call imposter syndrome. And it's the feeling that we're just pretending, that we don't really belong, that we're not good enough. The fact is that everyone you work with, no matter how self-assured they seem, experiences self-doubt. This is the human condition, folks. And these are just thoughts. So you don't have to believe them. How many of you don't ask for help? If this is a completely foreign idea to you, I suggest that you do it more often. People love to help. Think about how you feel when you get to help someone else. And remember, I just spoke about altruism. This is an example of that. Finally, decorate your space with things that breathe life into you while you're working all day long. So acceptance, flexibility, and non-judgmentalism. Pretty big things right now in our world. Mindfulness isn't a test of your skills. It's not a competition. There's no final exams. So rest easy. There's no papers to write either, folks. Relate to yourself with a sense of caring, curiosity, open-mindedness, and acceptance. Remember that everyone is going to experience and react differently to life, and especially to the situation we found ourselves for over a year now. We need to meet people where they're at right now, and that includes ourselves. So give yourself a break. Next slide.
Thanks, Linda. Some of those seem to be a little bit easier to say than to actually implement, but great tips nonetheless. Really, with that then, in looking at mindfulness, looking at the ways to alleviate burnout and really begin to thrive in work, leadership actions and communication can play a really vital role in the overall well-being of organizations and communities after crisis events, or even during crisis events, because we are still in a crisis. So understanding what to say and do really allows leaders and supervisors to more effectively support and influence their staff throughout COVID-19. We won't go through all of the items that are listed here on this slide, but I do want to just touch on a couple of them that I found to be important and interesting. So looking at practical supports, asking what's needed from staff to focus on their work duties and really to reduce that absenteeism and presenteeism. Family safety is another large one. So looking at having procedures to reduce infection risk really allows staff to feel comfortable coming to work and reduce stress for them as well as their family members. Again, communication, so timely, regular, updated, truthful messaging that articulate what's known and also what's not known. It really, and creating that realistic time for sharing additional information is going to help to enhance trust in organizations and leaders and improve compliance with recommendations, as well as optimizing functioning, offering that open door policy even in times of chaos. And lastly, I'd like to touch on reintegration. So challenges returning to routine work, whether that's in person, back virtual, the flip-flop that may be happening in the hybrid world, and family after an intense and prolonged periods of time can actually be more stressful than the actual work itself. So again, let me say that challenges returning to work can actually be more stressful, the thought of doing it, than actually the work that they may be undertaking itself. So anticipating and planning for challenges, educating and supporting staff will really help to improve that transition and again, optimize organizational functioning. With that, I'll turn it over to you, Nasha.
Here we go. Sorry about that. So as Erin just discussed how organizations can support their staff to help prevent burnout, and I'm going to provide you with some information that direct managers can use when interacting with their teams. If you look at the bubbles on the screen, these are some suggestions on how you can script yourself when you're interacting with your teams. Taking the time to actively listen and gain an understanding of the employee concerns or clarifying a conversation does not take long, and it can reduce a lot of problems if we just take a few minutes to listen. Linda's going to provide some tips for active and empathetic listening that may help in these types of situations.
Great. So these tips are going to be applicable to your customer base, but your coworkers as well, even your family and friends, though I won't tell anybody you got it from us. It's especially helpful when navigating difficult conversations. This type of communication makes individuals feel heard, it removes barriers and potential defensiveness. So be non-judgmental. You heard me say that earlier for a mindfulness tip for yourself, but it also works for others. It isn't always easy, and you have to let go of your own opinions. So it will free you to focus on what the other person is actually saying, their views and their emotions in that situation. Doesn't mean you have to agree with them. It just means that you're letting them know that you care and that they matter. Give the person your undivided attention. Remove distractions, give them your full focus. That also displays respect, and a person is more likely to stay calm and feel connected into that conversation when the distractions are removed. So listen carefully. Notice the tone of voice, the body language, and other clues that go beyond words to gain insight into that person's message through their emotions. Show that you're listening carefully. Think about your posture and your nonverbal messages, such as eye contact, right? Some agreeable nodding, that you're there with them, other signals. It advertises your attentiveness, and you don't have to interrupt to do that. Don't be afraid of silence. Sometimes all a person needs is to be heard and know that you're there. Silence is also an indicator that someone's processing what actually was just said. Restate and rephrase. If you speak, refer to the person's words themselves. Ask clarifying questions and comments as needed. Keep that non-judgmental and respectful spirit going, and give the person time to respond. Again, pausing and letting silence kind of take hold too. Respond based upon that person, situation, and moment. Follow up. Check with the person to see if they have further questions or comments, and potentially consider setting up another time to meet if needed, if that situation warrants that. We want you to think of ways that you listen in your day-to-day life and strategies that work best for you, and incorporate these tips into some of those things. For more tips, I'm going to turn it back to Erin.
Thanks so much, Linda. I want to share with you about the Stay Well grant program that is helping to bring this presentation to you today. The Stay Well grant program is here to encourage you to be kind to your mind. So all those things that we've talked about, so many of you identified with them, especially when looking at burnout, those signs of stress, etc. It's designed to, the Stay Well grant program is designed to help Michiganders cope with the anxiety and or distress caused by this pandemic. It's a free service funded by FEMA, managed by the Michigan Department of Health and Human Services. The Stay Well program goals are really to validate responses to the pandemic, but offering and promoting a variety of positive mental health and coping techniques. This can be achieved by utilizing our free and confidential 24/7 counseling line, free educational webinars, virtual support groups, as well as printed materials. The number to call to reach that hotline is listed here on this slide, as well as our website. And again, that information will be in the resource pack as well. What's something else that's interesting and maybe very enticing for you all is that Stay Well has also been used as an alternative to an employee assistance program. So again, as the program is a free and confidential resource to mental health services. So if you're interested in learning more or partnering, please see the options that are listed in your resource packet. Next slide, please. At the end of the day, we want to encourage you to be kind to your mind, to help others to be kind to their mind as well. We continue to live through a crisis with an indefinite timeline that's presenting risks to the rights and safety of everyone, but together we're going to get through this. Nasha, I'll turn that back to you.
Please also remember that we all have permission to rest. You are not responsible for fixing everything that is broken. You do not have to try to make everyone happy. For now, take time for you. It's time to reflect, replenish, relax, and refresh. There's a lot of information from today's training, which means there's a lot to process. And some of you might be thinking, where do I start? You can take some time after this training to reflect on these couple of questions. What are you already doing? How will you use the resources that are going to be provided or will be provided with your customers? And how do you use these resources with staff? Overall, please remember that mental health matters. What will you do to improve your own mental health as you work with others experiencing their challenges during this pandemic? So that concludes the presentation portion of this training in this session. Jeff, I'm not sure if there are any questions that we need to answer, but if there are, we can take Q&A now.
I didn't see any questions in the chat, but we still have a few minutes, so we can see if there are any questions that anybody has. Seeing none, this ends our presentation today. I'd like to thank our presenters. We appreciate everyone's time. I hope you've had some great takeaways, and I hope you'll enjoy all of the features of the conference. Thank you for attending the Michigan Works Annual Conference, and we look forward to seeing you tomorrow.